I am Professor Dr. Dharmesh H.S, practicing implantologist. I have made few videos based on the most frequently asked questions or queries post extraction instructions. That is, do's and don'ts after tooth removal. In this video, I will be explaining the do's and don'ts, that is, what you should do and what you should not do after the extraction of tooth or after the tooth is removed. For the convenience sake or to make it easier for you to understand, I will be explaining it in three parts, that is, the do's and don'ts in the first 1 hour of after extraction, do's and don'ts after 1 hour but within the next 24 hours, the do's and don'ts after first 24 hours or after the first day of extraction. What you should do in the first hour of extraction. Number 1, immediately after extraction, we place cotton or gauze at the site of extraction to stop the bleeding and encourage clot formation. Bite on it firmly for about half an hour to 1 hour. Number 2, keep swallowing the saliva. Number 3, please inform your dentist if you are feeling drowsy or dizzy. Number 4, it is always better if you are accompanied by someone during and in the first hour of extraction. What you should not do in the first hour after extraction. Number 1, do not spit. Number 2, do not disturb the cotton or gauze at the site of extraction either with your finger or tongue. Number 3, it is not advisable to drive. What you should do after first hour of extraction. Number 1, remove the cotton or gauze and dispose it. Minimal bleeding at the site of extraction after the removal of cotton is normal. Do not spit, do not panic, keep swallowing. Number 2, you can have an ice cream or cold milk or milkshake. Consume only soft and cold things. Do not use straw to drink the milk or juice. Number 3, take the medication as prescribed and instructed by your dentist, because medicines reduces infection and inflammation, that is pain and swelling, and help in faster healing. Number 4, if your dentist advise for cold pack, then go home, take an ice pack or wrap the ice cubes in towel and give an extra oral pack for 20 minutes on and 20 minutes off for first 24 hours. Number 5, eat only on the opposite side of extraction so that you will not disturb the extraction socket from healing. What you should not do after first hour of extraction. Number 1, after discarding the cotton or gauze that is placed at the extraction site by your dentist, do not replace the cotton by yourself because it might infect the extraction site. Number 2, do not consume anything hot, hard or spicy. Number 3, do not gargle or rinse vigorously for 24 to 48 hours because it will disturb the healing process. Number 4, do not touch the extraction site with your finger or disturb with your tongue. Number 5, don't eat anything till the effect of injection, that is anesthetic effect, wears off, because in case of lower teeth extraction, usually tongue and half of the lip will be numb without your knowledge. you would bite on tongue, cheek or lip and injure them. Number 6. Do not sleep on same side of extraction to avoid pooling of blood and it might increase the swelling. Number 7. Do not brush on the extraction site. Avoid brushing for first 24 hours or till the next morning. Now, what you should do after 24 hours of extraction? 1. Continue to take medication as per your dentist prescription and instruction. Number 2, you can brush your teeth after 24 hours but be gentle on the side of extraction and do not brush on the extraction site. Number 3, you can start gargling with warm salt water or mouthwash as suggested by your dentist after 24 to 48 hours but not before that. Number 4, in case of surgical or traumatic extraction, especially after wisdom tooth extraction, you can expect the swelling to increase in the first 24 to 48 hours. But you need not panic, it's quite normal and it will eventually subside. What you should not do after 24 hours of extraction? Number 1, do not stop the medications just because you are feeling better or painless. Please complete the course of antibiotics and other medications as prescribed by your dentist. Number 2, do not give any hot fermentation or hot pack at any point in time after the extraction. Number 3, get your sutures, if it is placed, removed any time after 5th day, ideally on 7th day. Number 4, don't smoke or drink alcohol for at least about 3 to 5 days after the tooth extraction to allow better healing. Follow these instructions carefully and contact your dentist over the phone only if it is absolutely required. It is always recommended to replace the tooth after removal except the wisdom tooth. Ask your dentist about different tooth replacement options. Please share this video among your friends, colleagues and family members to create awareness about the do's and don'ts after tooth extraction. For more information, log into my YouTube channel and you can also contact me on 9900008081. Please share these videos among your friends and family members to spread the right information about implants. Thank you.